This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
It's the leading cause of cancer deaths among both men and women.
In fact, the American Cancer Society reports each year more people die from lung cancer than colon, breast, and prostate cancers combined. Take a look at these numbers. The American Cancer Society estimates there will be about 228,000 new cases of lung cancer this year, with nearly 160,000 people dying from the disease this year. That accounts for about 27% of all cancer deaths.
In an effort to cut down on these high numbers, just last month, government advisors announced new guidelines on screening for lung cancer, screenings that are projected to save up to 70,000 lives every year. Joining us today to tell us more is Dr. Thomas DeMarco, Medical Director of the Richard A. Henson Cancer Center at Peninsula Regional Medical Center. Good afternoon, Doctor.
Good afternoon. Thank you for inviting me.
Let's start off with the startling lung cancer statistics and survival rates.
Okay.
Pretty amazing, the numbers that we've got here. Explain what it is we're looking at here between 2008 and 2012.
Well, what you're looking at here basically is data that we've collected at the Cancer Institute that shows stage for stage. Stage 1 is the very early stage of lung cancer, and stage 4 would be the most advanced. And as you can see, as the stage progresses, the 5-year survival rates, that's what the percent means. In essence, how many people would be alive 5 years after the diagnosis of cancer. If you look at the late stage disease there, you see stage 4, only 2% of those people would be alive in 5 years. If you look at the early stages, it's still not very good at 42 to 37. Now there's a difference in those numbers. Those are probably not statistically significant, but what it basically means is from 2008 to 2012, we've not done any better at taking care of lung cancer. Well, and this is what the important fact is about the screening program.
So why do you think it is that the numbers don't seem to be improving much?
We have not really had a good screening mechanism for lung cancer, and we haven't been that successful at getting people to stop smoking.
Okay, so there are some new screening recommendations. Tell us about those.
Correct. There was a national lung screening trial that recently came out that had 53,000 patients involved. And what it basically showed is they compared a low-dose CAT scan compared to the traditional chest x-ray. And what it showed is that if we did screening in certain patient populations with the low-dose CAT scan, that we decreased the mortality rate of lung cancer significantly in the lower stages. In essence, what was happening is we're diagnosed so much earlier than we can actually do something about it.
Okay, so who should get these?
Well, the recommendations, according to this trial right now, is that patients that do smoke that have a 30-pack year history, and what that means is that you've smoked an average of 1 pack a day for at least 30 years. That would be if you smoke 2 packs a day for 15 years or the like. That's what it is. People who have a 30-pack year history between the ages of 55 and 74. Also people who might have quit smoking, but they have to have quit smoking within 15 years. Those are the groups of patients that would be good candidates for lung cancer screening.
What if I'm not a smoker, but I've been exposed to secondhand smoke or even chemicals?
Well, common sense would tell you that that still would be a good population to screen. However, we don't have the scientific data to back that up.
So when it comes to the screenings, what do they show?
Okay, what we basically show is we have a mechanism where we can use a very low dose CAT scan, as I said before, so we decrease the amount of radiation used significantly. And it only takes about 12 seconds for the test to actually be performed. So it's not very much of an effort for the patient whatsoever. And then we look at the CAT scans, and the radiologist can tell whether or not it's suspicious or not.
And you have an example of that CAT scan you're going to show us here?
Yes, if you look on the screen right there, on your right-hand side to the far right-hand side of that x-ray, you'll see kind of a circular, irregular white area, and that is very suspicious for a lung cancer.
Now, what's that big long thing there?
The big long thing in the middle is your aorta, so that's normal.
Don't pay attention to that.
And all the black and the little white dots, those are normal too. It's that big white area on the right-hand side there that is very suspicious.
Wow. All right. So let's talk a little bit about false positive results. Is there a high rate of those?
False positive is always a risk when you're doing any kind of screening. And in the study, they looked very carefully at the risk-benefit ratio, in essence. is it worth the risk of a CAT scan and worth the risk of perhaps a negative biopsy in order to diagnose earlier stage lung cancer? And the risk benefit was definitely in the positive realm. The benefit far outweighed any risk. So that's been proven again.
Great. Now, will insurance cover all this?
Presently, insurance does not cover this in most instances. However, recently with the United States Preventive Task Force coming out with their draft recommendation, very much in favor of this. I think it's going to put a lot of pressure on the insurance companies, and I think Medicare itself will probably most likely agree to cover this.
Okay, let me ask you this. Specifically, the screening insurance won't cover, but if I'm showing symptoms already?
Right. If you have any symptoms whatsoever, or if you had a positive screen and you needed to be worked up for that screen, that would all be covered in your normal insurance.
Dr. DeMarco, recently there was an article in a popular magazine that brought up other lung cancer screenings, such as a saliva, nose swabs, or even breath that test for lung cancers. Tell us, do you have an opinion on those?
Well, they probably have a lot of promise, and what that basically is, it's all based on DNA testing. Now, with the Human Genome Project, we know how the human genes and DNA are all laid out. We know exactly what it is, and we know every cancer has a different gene prototype, and that's what we're looking for. But presently, the only significantly statistical scientific data is the low-dose CT for lung cancer, although those perhaps in the future will be very promising.
So that's the best way to go. Dr. DeMarco, thank you so much for the information this afternoon. Some incredibly valuable stuff. Now, if you'd like more information about the new screenings or to learn more about the Richard A. Henson Cancer Center at PRMC, all you have to do is go to delmarvalife.com and click on the Show tab.
Well, we just touched on lung cancer, but really any cancer diagnosis is life-changing, and the type of care you receive during and after your treatment is extremely important. Up next on Delmarva Life, we'll tell you how it's possible to treat certain cancers from the comfort of your own home.
But first, moments ago, we heard how much of an impact smoking has on your lungs. Dr. Oz has tips on how you can quit.
Every year, 500,000 people die from the effects of smoking. Why do 1 in 5 people still light up? Smokers continue not because of lack of willpower, but because of fear. Thinking, if I do it and fail, will I be less worthy than I am now? But take these steps towards a life of breathing easy. Build a support system. People you can talk to when a nicotine fit hits. Make a list of all the reasons to quit and set a date. Replace your bad habit with a healthy habit, such as walking 30 minutes a day to help fight post-smoking weight gain and build healthier lungs. And finally, protect yourself from a relapse. Have some last-ditch support mechanisms like keeping cinnamon sticks or tea handy to put in your mouth instead of cigarettes.